subcommittee will come to order. Good morning. I want to thank you all for being here today to discuss nutritious food in the Supplemental Nutrition Assistance Program, or SNAP. I want to welcome all of our witnesses, and I look forward to the discussion. SNAP is our nation's largest food assistance program with 41 million participants, which is 12.3% of the population, or about 1 in 8 Americans. The core mission of SNAP, as defined by Congress in the Food and Nutrition Act of 2008, is to enable low-income households to obtain a more nutritious diet and to decrease hunger and malnutrition. While the SNAP program is effective at meeting the latter part of this goal, we are failing at providing SNAP recipients a more nutritious diet. Recent research has demonstrated that SNAP participants still experience significant disparities in diet quality and disease risk. In fact, children participating in SNAP have a higher disease risk and consume 44% more sugar-sweetened beverages than income-eligible non-participants. In 2016, USDA's Food and Nutrition Service acknowledged that soft drinks are the leading purchase using SNAP benefits, and they found as much as 20% of SNAP purchases are spent on sweetened beverages, desserts, salty snacks, candy, and sugar. SNAP participants spend more on sweetened beverages than non-SNAP participants. For these reasons, I'm deeply concerned that our largest nutrition program has effectively become a multi-billion-dollar taxpayer cost to buy non-nutritious foods that actually exacerbate the nation's obesity epidemic. In recent years, there have been significant advances in medical research on diet-related diseases. According to the NIH, eating high-calorie, low-nutrient foods and beverages, including high quantities of added sugar and saturated fats, increase your risk for overweight and obesity. The NIH also acknowledges that obesity increases the risk of heart disease and is clearly linked to type 2 diabetes and cancer. Poor nutrition and obesity are linked to increased risk for preeclampsia, maternal morbidity, liver disease, and others. And we now understand that high sugar foods trigger insulin production, making you hungry, and are indeed addictive. We find ourselves in an obesity epidemic where 3 in 4 adults aged 20 or older have either overweight or obesity, and nearly 1 in 5 children have obesity. When I was in medical school, liver transplants for serious liver disease were almost exclusively done in adults, primarily those with serious alcohol use. But now, 10% of children have non-alcoholic fatty liver disease, with some even requiring liver transplants. This was previously unheard of. 2005 became the first time in history when children were expected to have a shorter lifespan than their parents. The decreased lifespan was attributed to climbing rates of childhood obesity. As members of Congress, we have an obligation to acknowledge this wake-up call and reevaluate our priorities on supporting nutrition. Subsidizing foods that harm health and nutrition is counterproductive to the original purpose of SNAP. Almost every other domestic nutrition program funded by this subcommittee, including the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC, the National School Lunch Program, and the School Breakfast Program, specifically provide nutritious foods. As a result, these programs have been found to improve diet quality and reduce health costs. However, as the largest federal nutrition program, with a budget of $122 billion in this fiscal year, the SNAP program is solely focused on providing calories rather than nutritious food. This subcommittee has a vested interest in ensuring SNAP is delivering on its original intended goals. In their FY23 Research and Evaluation Plan, USDA's Food and Nutrition Service expressed interest in exploring a pilot program to support healthy food choices by allowing restrictions on the use of benefits for less healthy foods, particularly sugar-sweetened beverages. In fact, over the past 20 years, multiple jurisdictions, including Maine in 2016, Minnesota in 2004, New York City in 2011, and Virginia, have expressed interest, and Virginia most recently, have expressed interest in restricting SNAP purchases of sugary drinks or food. To date, USDA has denied every official request to restrict unhealthy purchases. But establishing a restriction pilot is a proposal worth exploring. Let me be clear. This would not be a program change across the entire country, but limited to pilots to test the concept and to provide data. I look forward to discussing the current state of nutrition in SNAP as well as opportunities for improvement today. Ranking Member Bishop, I will now yield to you for any opening remarks you'd like to make.
Thank you very much, Mr. Chairman. And I'd like to welcome all of our witnesses today, especially my fellow Georgian, Mr. Michael Gay. The testimony that you've submitted is very powerful, and I hope that during our discussion today that you can expand on the reasons why restricting food choice is misguided and ultimately undermines the purpose of SNAP. These restrictions harm American families. They burden 262,000 food retailers, and they impede the federal and state governments that administer the program that helps to fight hunger. During today's hearings, we will evaluate and scrutinize a pilot program that's being proposed by the majority. Though it tells poor people what to eat, it does little to address the underlying challenges that we face in fighting hunger. Researchers like those at the Center on Budget and Policy Priorities have already demonstrated that one of the greatest hurdles SNAP participants face in purchasing healthy foods is a modest amount of support that SNAP provides. A healthy diet costs more. If the other side is going to argue that people using SNAP should be limited to healthier options since they're eating on the government dime, they need to join us in the 21st century and realize that a healthy diet costs more than a dime, or the average $2 per person per meal that SNAP provides. Simply restricting, in the name of health, what Americans with the greatest need can purchase with SNAP without providing sufficient funding for them to afford a healthy diet is really more about trying to undermine SNAP. And that increases the likelihood that American families will go hungry. To make matters worse, this ideological exercise will cause collateral damage to our food retailers, as well as federal and state SNAP administrative authorities. Talk about interrupting supply chains. We must remember that what happens to SNAP has far-reaching effects on our food retailers and on the families supported by the program. I ask unanimous consent to enter into the record 2 letters from the National Grocers Association and one from a coalition of nutrition groups and industry. I'll just note to my colleagues that there are 2,500 individual grocery stores opposed to restricting SNAP purchases who signed on to the letter, a few of whom might be in the districts of some of these members. I think, Dr. Harris, I think your district has 45 independent community grocers. Mr. Valadeo, your district has 67 stores. Mr. Molinar, your district has 70. Mr. Newhouse, 74. Ms. Letlow, your district has 80 independent community grocers. Mr. Klein has 23. Mr. Henson, 84. Mr. Carl, 53. And Mr. Franklin, 31. It's also important to note that USDA already has the authority to approve a pilot program, and other government entities may propose them. This has not happened. Why? Well, in part, because if the goal is to make sure that those with the greatest need in our country can afford enough healthy food to feed their families, then you need to come to the table with clear suggestions, not only about what constitutes healthy food, but also how to ensure that everyone in need of SNAP can afford these foods. Simply put, the majority's proposal is, at best, a half-baked idea, and at worst, a negligent suggestion that misses the mark. To be clear, no one here disputes the importance of proper nutrition. If the majority wants to make sure that families who use SNAP can make healthy food choices, we already have the Gus Schumacher Nutrition Incentive Program, also known as GusNIP. It provides a solid research framework for looking at supplementing SNAP benefits to get participants to better health. It would be reauthorized in the Farm Bill that Agriculture Committee Chairman Thompson just released, and the mandatory funding provided is increased in that bill substantially. I would also point out, Mr. Chairman, that you've been saying that SNAP should follow the WIC model, where food choices are limited. Well, let us look at the WIC model. Excuse me. In the WIC model, participants must be assessed by a medical professional and be determined to be at nutritional risk, meaning according to the Food and Nutrition Service, that an individual has a medical-based or dietary-based condition. There are no health screenings for SNAP. If the intention of the majority is to promote a program with healthy choices and healthy outcomes at its heart, and argue that the WIC model should be followed, then where are the health screenings in the proposed pilot program? Families supported by SNAP face many barriers when trying to buy healthier food, including being physically disabled, as 22% of recipients were in 2020, having no income other than SNAP, being homeless, not having proper storage for fresh fruits and vegetables, being in a food desert, or only having access to stores that don't stock these items, not knowing much about the impacts of dietary choices, lack of time to prepare meals from scratch, not having transportation to get to a store with a variety of healthy options. To fully understand these challenges, evaluate our nutrition programs, and then make changes where needed, we need to hear from witnesses who have hands-on experience with the SNAP program. This includes families who have used the program, our grocers who sell the food, and the states who are making great strides in fighting hunger in their backyards. Though the pilot program we discussed today appears to miss the mark, we would love to work with the chair to find ways to address these issues, which would accomplish our shared goal for nutrition and food security and better healthy choices. I yield back, Mr. Chairman, and I'd like to ask unanimous consent that the letters that I have be submitted to the record.
Without objection, and I ask unanimous consent that a letter from the Nutrition Coalition for Evidence-Based Nutrition Policy be entered into the record. No objection, it will be. Thank you, Mr. Bishop. I'd like to introduce our witnesses joining us this morning. First is Dr. Angela Rashidi, I hope I pronounced that right, fellow with the American Enterprise Institute. Next is Mr. Michael Gay, an independent grocer from Claxton, Georgia, representing the National Grocers Association. Then we'll hear from Mr. Robert Seligson, CEO of the Physicians Foundation, and finally, Dr. Robert Lustig, Emeritus Professor in the Department of Pediatrics at the University of California, San Francisco. We appreciate all of you joining us today. Without objection, all of your written testimony will be included in the record. Dr. Rashidi, I will now recognize you for your statement.
Chairman Harris, Ranking Member Bishop, and members of the subcommittee, thank you for the opportunity to testify on this important issue of nutrition. My name is Angela Rashidi, and I am a senior fellow at the American Enterprise Institute. Before that, I was a deputy commissioner for the New York City Department of Social Services for more than a decade. Among other programs, we administered SNAP, which provided benefits to almost 2 million New Yorkers each month. I want to focus my testimony on specific ways that SNAP can better meet Congress's charge of improving nutrition. Poor diet has contributed to an explosion in obesity and diet-related disease among all Americans, but especially among low-income people. Simply stated, poor health is placing a tremendous social and emotional strain on low-income families. When SNAP expanded in the 1960s and 70s, then called the Food Stamp Program, the crucial problem facing low-income households was hunger and malnutrition. We face a much different environment today. Since the 1970 Food Stamp Act passed, SNAP has grown into one of the nation's largest safety net programs. In 2000, 7.5% of the population received SNAP. In 2023, 12.5% of the population receives it. SNAP expenditures have more than tripled in inflation-adjusted dollars, with benefits exceeding $107 billion per year compared to roughly $30 billion in 2000. In some sense, the growth of this program has led to impressive results. However, SNAP is performing poorly on the nutrition front. And SNAP participants disproportionately suffer from obesity and diet-related disease. According to research I recently conducted with Thomas O'Rourke at AEI, 25% of SNAP participants have diet-related disease, compared to 11% of non-recipients. When it comes to obesity, 1/3 of SNAP recipients suffer from obesity, compared to 1 in 5 of non-participants. If we consider the data on food security together with health information, less than 1% of U.S. children and up to 5% of adults experience hunger in this country. But 20% of U.S. children and 42% of adults experience obesity. Stated simply, obesity and diet-related disease is a much larger public health problem in this country than hunger. This brings me to ways in which SNAP can help this public health crisis. A recent proposal from this subcommittee was to fund pilot programs that assessed the effects of nutrition-based restrictions. I want to touch on 3 quick points related to SNAP restriction pilots. 1, the idea to pilot restrictions has a long history with support from a wide variety of experts. 2, existing evidence suggests SNAP restrictions would effectively reduce consumption of unhealthy items. And 3, we need an evidence-based approach to addressing poor health among SNAP recipients, and pilots could answer many lingering questions about the effectiveness of this approach. Existing evidence suggests that nutrition-based standards can be effective. A randomized controlled trial of a restriction program in 2013 found that restrictions improved diet quality, especially when paired with incentives to purchase fruits and vegetables. Many people object to nutrition-based standards because they believe it is not the federal government's role to tell people what they can and cannot eat. However, the purpose of SNAP is to provide a supplementary benefit to low-income households for nutrition assistance, making pilot testing nutrition-based standards part of an ongoing effort to assess whether SNAP can better meet its goals. Others oppose nutrition-based standards because they fear that it will adversely affect the grocery industry or increase the overall cost of food. However, it is worth repeating that SNAP is a program designed to improve nutrition and promote upward mobility among low-income Americans. Concerns over how it will affect grocers and costs are important, but those concerns must be balanced with the need to utilize taxpayer assistance for its intended purpose, in this case, to improve nutrition. In closing, I want to state the challenges and opportunities that we are presented with today. Poor diet and related disease negatively affects employment, productivity, quality of life, and emotional health. Low-income Americans and SNAP participants in particular suffer from these conditions. Using SNAP to improve diet quality is a small part of what should be a broader policy approach. It remains crucial to an overall strategy aimed at getting all Americans to improve their diets and get healthier. Thank you, and I look forward to answering your questions.
Thank you very much, Dr. Rashidi. Mr. Gay, you're now recognized for your statement.
Good morning, Chairman Harris, Ranking Member Bishop, and members of the Agricultural Appropriations Subcommittee. My name is Michael Gay, and I operate Food Fresh, an independent community grocery store in Claxton, Georgia. It is an honor and a privilege to be speaking with you today. My store, Food Fresh, is the only full-service grocery store in Evans County, Georgia. I proudly employ 52 people and boost local tax revenues while bringing choice, convenience, and value to hardworking Americans. At Food Fresh, we work hard every day to make our community better. One way we do that is by accepting both SNAP and WIC in our store to ensure food access. As a full-service grocery store, we offer a wide variety to meet the needs of the individuals in my community. The impact of my store goes well beyond the food I provide. I will be bringing in the local high school culinary career academy to do demonstrations for our customers on how to make healthy meals. I participate in the backpack program where we help fill backpacks for kids who may not have food on the weekends. In June, I have a local physical therapist coming to teach folks simple exercises they can do at home to stay mobile. We all share the same goal of improving the health of Americans, and my role as a grocer is providing a wide range of options that can meet the diverse dietary needs of all my customers. Choice and flexibility makes SNAP the effective program that it is today. A one-size-fits-all approach seems great on paper, but it doesn't work in the real world. A child doesn't have the same nutritional needs as a pregnant mother or a grandparent suffering from cancer and struggling to maintain weight. All Americans deserve the freedom to decide what they feed themselves and their families, including those who rely on SNAP. In February, nearly 2,500 grocers signed a letter to Congress opposing SNAP restrictions, including piloting this policy. As stated in our letter, restricting eligible items to those by the USDA will quickly drive up food costs and strangle the program with needless red tape. Given that grocers operate on a 1% to 2% net profit margin, we cannot afford to absorb the costs for implementing SNAP restrictions, and it could be passed on by burdening all of our customers at this time of record inflation. That's the last thing I want to do to any of my customers. Many NGA members have been on the front lines of implementing the Gus Schumacher Nutrition Assistance Program, also known as GusSNP. SNAP participants who utilize the nutrition incentive purchase more fruits and vegetables than the average U.S. consumer. When administered properly, nutrition incentives are an important addition to SNAP and can be truly effective in achieving the goal of promoting the consumption of fruits and vegetables. When thinking through a policy to restrict SNAP nutrition, it is important to consider the logistics of implementation. USDA would provide complex guidance and leave grocers to fend for themselves in determining what is in and out of the program. Reviewing complex USDA guidelines may be possible for big grocery stores, but 1/3 of all grocery sales happen at independents like mine, and we would have a much harder time making restrictions work. In a pilot situation, each state would be making its own rules, leading to more confusion and a bigger headache for independents. Piloting this program also puts grocers in border towns at risk of going out of business because SNAP participants are likely to cross state lines to use their benefits as they choose. We have seen evidence of this with other state and local food restrictions that have been put in place. In Philadelphia, the city implemented a 1.5% soda tax, leading to a 25% drop in business for one NGA member, forcing the store to close its doors. If a grocer goes out of business and the community loses access to food and the locality loses a crucial tax base. If SNAP customers choose to stay and shop with me instead of leaving the state, they will encounter their neighbor, the cashier, who has just become the food police. My cashiers will now have to tell people what they can and cannot purchase for their families. This will cause embarrassing disruptions at the register, impacting every customer that comes into my store. This will disrupt a process that currently runs smoothly and negatively impact relationships in my community. Independent grocers offer so much more than food. We offer economic viability to the towns we serve. With SNAP Choice, every American, regardless of their financial situation, has the flexibility to shop and feed themselves and their families in the way that works best for them. That's good for all of us.
Thank you very much. Next, Mr. Seligson, your testimony.
Thank you, Dr. Harris. Good morning. My name is Robert Seligson, and I'm the CEO of the Physicians Foundation. We are a nonprofit association comprised of 20 major medical associations across the United States representing America's physicians. Our broad membership encompasses states such as Florida, California, New York, Georgia, Washington, Louisiana, and others representing physicians who are practicing in rural, urban, and suburban areas. Our mission is to empower all physicians to provide high-quality care and offer leadership to shape the future of healthcare in America. The Foundation pursues this work through research, education, and grant-making that improves physician well-being, strengthens physicians' leadership, addresses drivers of health, and provides physician perspectives in healthcare policy making. I am grateful for the opportunity to be here today to discuss the need to address the epidemic of diet-related chronic disease that is plaguing our nation and the entire healthcare system. My comments focus on ways to redirect federal nutrition resources to tackle the epidemic, including through the Supplemental Nutrition Assistance Program. The Foundation has conducted extensive research documenting how nutrition and food security have had a major influence on individuals' health and the cost of health care. A 2021 Foundation-supported study found that the failure to address drivers of health may indicate missed opportunities for reducing geographic variation in spending and for reducing health disparities in regions with disadvantaged social conditions, emphasizing that the greater investment in healthy food access, for example, could lead to a reduction in healthcare spending. 80% of health outcomes are dependent on socioeconomic factors such as healthy food and safe housing. Addressing these drivers of health is an imperative if we are to make progress on chronic health conditions. Unfortunately, studies show that the rate of diet-related diseases and obesity is significant and growing among SNAP recipients. SNAP can and should be employed to guide historically underserved populations disproportionately impacted by diet-related illness toward nutritional choices that can lead to better health. Diet-related illnesses are a burden to patients and resource-intensive for physicians. The inability to address patients' driver of health is a major factor in physician burnout, as treating patients with unhealthy diets with overconsumption of processed or high-fat foods and sugary beverages is a constant challenge. These unhealthy foods are strongly linked to chronic diseases such as obesity, type 2 diabetes, hypertension, and cardiovascular disease. It is troubling to see that the growing evidence linking overconsumption of sugar and obesity to mental health, including depression, anxiety, and attention deficit disorder in children, teens, and adults. Physicians play a crucial role in educating patients about the repercussions of poor diets and the importance of healthy eating habits and personalized nutrition. It's a resource-intense responsibility given the limited time constraints of a clinical visit. We have sought to make a difference in this area, funding resources to enable physicians to address drivers of health in clinical settings. The Physicians Foundation 2020 survey of American physicians found that 73% of physicians indicate that drivers of health, including lack of access to healthy food, are driving demand of healthcare services. The United States Department of Agriculture cites that 85% of healthcare spending is related to diet-related chronic disease. With significant contribution from the Physicians Foundation in 2023, Medicare finalized new payment codes that in part account for clinical resources used to identify unmet social needs, including nutrition deficiency, and to facilitate access to community-based resources. The Physicians Foundation has developed considerable resources on the need to address drivers of health, including through increased access to healthy food to improve health outcomes and reduce healthcare costs. A movement to ensure foods purchased with SNAP dollars are nutritiously dense would require experimentation, study, and further work on guideline education and programs that support and incentivize the purchase and consumption of healthier foods like additional fruits and vegetables. We support the committee's effort to develop a SNAP program, giving our most vulnerable citizens good quality food and to begin gathering needed study data to ensure that SNAP recipients have access to foods that will heal, not harm. Thank you for the opportunity to speak to you today about the important work of enhancing the lives and health of Americans.
Thank you, Mr. Seligson. Dr. Lustig.
Dr. Harris, Ranking Member Bishop, members of the committee. My name is Robert Lustig, Emeritus Professor of Pediatrics at UCSF. I'm a pediatric neuroendocrinologist, and I was head of the obesity program at UCSF for 16 years. I'm involved in research, clinical care, policy, and advocacy, and I am here to state for the record that I am for dessert. For dessert. I am not for dessert for breakfast, lunch, snacks, and dinner. The added sugar in the American diet is both toxic and addictive. The global crisis of non-communicable disease continues to chew through the lives and money of the U.S. and around the world. Despite clear knowledge of the diseases, the causes, and the consequences, virtually no headway has been made in stemming the tide of this NCD tsunami. Not only the frequency and prevalence of these diseases increasing, but the age at which they are occurring is getting earlier as well, and that increased the cost of delivering health care to the affected populations, with fewer people being able to pay into socialized healthcare delivery systems such as Medicaid. Currently, healthcare costs are at 17% of GDP, yet NCD costs are 75% of those, which means that right now NCDs constitute 13% of GDP. This is bankrupting the healthcare budget and placing untoward burdens on its delivery. You can't fix healthcare until you fix health. You can't fix health until you fix diet, and we haven't fixed the diet. Worse, yes, these diseases now affect children. Type 2 diabetes and fatty liver disease used to be the diseases of alcohol. Now they're the diseases of 5-year-olds. Today, the average lifespan of a 3-year-old is 1.5 years shorter than that of a 38-year-old. Social Security's a legal pyramid scheme. The young, healthy people have to pay in for the old, infirm people to take out. But what if the young, healthy people aren't healthy? What if they're not paying in, but rather taking out? The entire pyramid collapses. There are 2 myths that have to be debunked before we can get a handle on this scourge. The first, it's about obesity. Why is it that 93% of Americans now manifest at least one aspect of metabolic dysfunction, yet only 65% are overweight or obese? In fact, metabolic syndrome is the problem because these are the diseases of dysfunctional mitochondria, and that is where the toxin is acting. Number 2, all calories are the same. Not true. Certain consumables convey disease exclusive of their calories. For instance, alcohol is toxic not because of its calories, but because it's metabolized to a toxin. Trans fats are toxic not because of their calories, but because they can't be metabolized and the toxins build up in the liver and arteries. Likewise, sugar is metabolized the same way as alcohol and causes the same diseases. How else do we explain the stunning rise in type 2 and non-alcoholic fatty liver disease in 1/3 of the American population and in 1/4 of children? These used to be the diseases of alcohol, and now they're the diseases of 5-year-olds. Sugar is a chronic dose-dependent mitochondrial toxin, just as is alcohol, and it makes sense because, after all, where do you get alcohol from? Fermentation of sugar. It's called wine. Furthermore, this past Friday, I was at the International Food Addiction Consensus Conference in London. The epidemiological, neurochemical, and imaging studies confirm that sugar is addictive. Indeed, sugar is the alcohol of the child. Drugs are a luxury, food is a necessity. How can a consumable like sugar that is necessary for survival also be addicting? Maybe because certain consumables are not necessary for survival. We need essential nutrients like amino acids and certain fats and vitamins and micronutrients, or we die. And yet foods that contain these essential nutrients are not addicting. In fact, the only foods that are addicting are those that are not required, the luxuries. Alcohol is the most addicting, but sugar is the one that's available even to newborns. And that is why we have an epidemic of obese newborns. Everyone likes sweet. It's the fructose molecule that drives the reward center specifically. It's the fructose we crave, just like alcohol. Fructose might be an energy source, but it is not a nutrient because there's no biochemical reaction that requires it, just like alcohol. And fructose is something we love, something we want, and even to excess, even to binge, just like alcohol, but it's not necessary because we don't need it. It's called dependence. Just because there are social drinkers that can put a beer down doesn't mean that alcohol isn't addictive in others. 20% of Americans are alcohol addicted. Just because sugar can be put down by some people without serious sequelae doesn't mean that sugar isn't addictive. In fact, 20% of Americans are thought to be sugar addicted. Sugar used to be a condiment, now it's a diet staple. Soda, juice, sweetened teas, frappuccinos, these are all desserts. Chinese chicken salad is dessert, okay? It's up to elected representatives to ensure the public good when the market fails to do so. When the market failed with alcohol, tobacco, and opioids, Congress stepped in. In the case of sugar, the market has failed miserable, and Congress has done nothing. The preconditions for social intervention of any substance include ubiquity, toxicity, abuse, and externalities, or negative impact on society. Sugar meets all 4 of those. So does heroin, cocaine, amphetamine, tobacco, and alcohol, and societies regulate them. Sugar meets all 4 criteria as well. It's time for some social intervention on sugar, and SNAP is where you start. Thank you.
Thank you very much, Dr. Lustig. And now we'll go to questions, and we'll have a first round is 5 minutes per person. Mr. Gay, thank you very much for being here. I appreciate you being here. I have a question about the National Grocers Association because in your testimony on page 2, paragraph begins, "We all share the same goal of improving the health of Americans." Do members of the National Grocers Association sell tobacco in their stores?
Some of them do, yes.
Do you?
I do.
So you sell tobacco in your stores? but you claim we all share the same goal of improving it. Do you think that improves the health of Americans?
Do I?
Yeah.
I leave those options up to the customers. It has no bearing on what I think is nutritious for my customers.
Okay, but it says we share the same goal of improving the health. So if you share that goal, why would you sell tobacco in your stores? I'm missing something here. Is it because there's a profit to be made from selling tobacco in your stores? Because customers want it?
It's because there's a customer
Customer demand for a product that's bad for their health, you make a profit, so you sell it. I get it, and not all members of your group do. You also say that if restrictions become the law, foods not allowed on the program could be moved to out-of-pocket purchases and likely not change an individual's purchasing habits. Is that your testimony? Because there are some people who believe that. If we just say, well, you can't buy the sugary beverages with your SNAP dollar, you'll buy it with your dollar out of your pocket. But that's in your testimony. It's in black and white here. Is that true? Do you believe that?
Some of them will, yes.
Well, that's not what it says. It says likely not change an individual's purchasing habits. So when you say that you're going to go across state lines to do this, but your testimony is that individuals just going to buy it with their
Yes,
own
I was
money.
unclear on the question. Yes, if I have a choice, if customers of mine have a choice to drive 10 minutes to a store in Georgia or 10 minutes to a store in Alabama because they live on the border, they will make that decision to drive 10 minutes to Alabama.
But you say they're going to purchase the sugary beverages with their own money anyway. That's your testimony. It's on page 3. I've never seen so many straw men set up since you watched like The Wizard of Oz. I mean, this is unbelievable. You set up straw men, and in your own testimony, you contradict it. Now, you say you don't want your cashiers to be the SNAP police. Do you sell alcohol in your store?
Yes.
Oh, you do? And when you go to the checkout, does your cashier have to do anything to the person with the alcohol in their cart?
Yes, they have to check for an ID, which is a law of the land.
Sure, and the same with tobacco, right?
Correct.
So your cashiers are already police for unhealthy things, right?
No, sir. That's a legal. Are you going to put in the pilot program that I have to check IDs for SNAP participants?
No, what we're going to say
All right,
is
well, then that's how they become the police.
we're going to
because-
say you're going to limit things. So for instance, if someone with a WIC card comes up and puts something in a basket that is not eligible for WIC, does your cashier have to say, well, you can't use your WIC funds on that?
Yes.
Oh, so they're policing WIC as well. I see. What percent of your SKUs in your supermarket are for non-SNAP eligible items? And I mean including your pharmacy, including the aisle that has the household stuff. What percent of SKUs in your store are SNAP eligible SKUs?
Probably 90%.
90%. Your grocery store must be different from everyone I've walked in now, because if I walk down the aisle that says the dog food and cat food and it has the household.
Yes, I understand the question. I
Okay, so
understand. Yeah.
and you're going to get, okay, and I'm like.
90%.
90%.
We sell mostly food. And yes, the
Not of
police-
sales, of SKUs.
Oh, I understand your question. But you're also asking a question of policing. It's not policing WIC when somebody comes through. I just simply tell them their WIC benefits don't cover that item if they'd like to purchase it. And that is a very, very small amount of SKUs. When we stretch that to 90% of the SKUs in the store, that policing becomes a much, much larger problem.
So the mechanism's in place. I understand. Thank you. Dr. Lustig, you're a neuroendocrinologist, a professor emeritus at UCSF. And I got to tell you, when I was at faculty at Hopkins, we kind of looked up to UCSF. They were kind of our West Coast equivalent. It's a pretty prestigious place. And you're a pediatric neuroendocrinologist. Your testimony, which is striking, is that sugar is addictive. Now, a neuroendocrinologist is exactly the person who would understand whether it's addictive because of the interaction between the endocrine system and the brain. Could you explain how it's addictive?
Anything that stimulates dopamine in the nucleus accumbens. Anything that stimulates dopamine in the center of the nucleus accumbens is in the extreme addictive. So we have substances, we have behaviors. Substances like cocaine, amphetamine, nicotine, alcohol, heroin, sugar. And we have behaviors: shopping, gambling, social media, internet gaming, pornography. All of those stimulate the nucleus accumbens. And in the extreme, all of those are addictive. There's an aholic after every one of those: shopaholic, sexaholic, alcoholic, chocoholic, you name it. Bottom line is, dopamine is an excitatory neurotransmitter. It excites the next neuron every time. And it doesn't matter which receptor it is, dopamine 1 through 5 receptor, it excites the next neuron. Now, neurons like to be excited, that's why they have receptors, but neurons like to be tickled, not bludgeoned. They like to fire, then they like to come back to rest. Chronic overstimulation of any neuron anywhere in the brain will lead to neuronal cell death. And you know this, being a critical care physician. This is why we have to stop status epilepticus in children, because ultimately that will cause cell death and severe, severe neurologic consequences. Well, the bottom line is neurons have a plan B. They downregulate the receptor so that they won't be overwhelmed. They won't die. And so what happens is you get a hit, you get a rush, receptors go down. Now, next time you get another hit, receptors go down, then you need a bigger hit and a bigger hit and a bigger hit until finally you need a huge hit to get nothing. That's called tolerance. And then when the neurons actually do start to die, that's called addiction. Anything that stimulates dopamine in the extreme can lead to addiction. Sugar has been shown through neuroimaging, through neurochemistry, through epidemiology, through demographics, through functional MRI, through PET scanning, to basically cause that dopamine release that ultimately leads to that cascade that leads to addiction.
Thank you very much, Doctor. And I'll perhaps delve in a little bit more in a second round. Mr. Bishop.
I appreciate the passion that you bring to this issue, but I need to flag some of the things that you say.
Please.
You compare sugar to heroin, cocaine, amphetamines, alcohol, and tobacco, and I understand what you mean, but there are thousands of Americans who make their living growing and processing sugar and corn. You say the current school breakfast consists of Fruit Loops and chocolate milk. That is indeed a distortion of the school foods program.
Is it?
The CDC says that school meals are nutritious. Research shows that students who participate in the school meal programs consume more whole grains, milk, fruits, and vegetables during meal times and have better overall diet quality than non-participants. You suggest that the USSC, the University of California, San Francisco campus, banning the sale of sugary beverages is a model for your SNAP proposal. I could suggest a lot of differences between the people at UCSF and the SNAP population, starting with income. You say that your focus group people in the Bronx who told you that they would give up soda if they could have, quote, free water, vitamins, or other nutritious foodstuffs. But Dr. Lustig, the key word in that sentence is free. The average income in the Bronx in 2022 was $27,271. But they can't afford designer water or vitamins or adequate amounts of nutritious food. That's the blind spot in your testimony, asking SNAP recipients to use their very limited benefits for foods that are much more expensive. You say that it is up to elected representatives to ensure the public good when the market fails to do so. Companies are not required to be the food police or ensure public good, but they have produced many healthier foods in response to the market. Look at the smaller cans of drinks like Coca-Cola, but they wouldn't do that if the customers weren't interested. If Congress tried to ban or severely regulate sugar consumption, the American people would be extremely upset. It isn't how we do things in this country. I know that you are a distinguished medical doctor and a physician, and that you're passionate about what you do, and I respect that. But I don't think you've considered the impact of restricting SNAP foods on business persons like Mr. Gay. Nor do I think you've considered the complexity and the cost of any significant pilot on restricting SNAP choice, as we've seen in the Massachusetts and the Minnesota studies. Finally, there's the issue of singling out SNAP recipients for this experiment. I don't think they will see this as showing that they matter and that it's designed for their benefit. It will say to them that they can be treated like children and they can be told what not to eat. With that, I yield back.
May I respond?
You may.
With all due respect, Ranking Member Bishop, I couldn't disagree more. It is true that people say that a reduction in SNAP benefits would be regressive against the poor. Do you know what's more regressive against the poor? Diabetes. In fact, the rate of diabetes in the Bronx is so high that they actually have an NGO called Not 62. Because of the 62 counties in New York State, the Bronx always comes in number 62 in terms of healthcare and mortality. And it is because of that that they want to be number 61. And so they would be willing to give up soda in order to be able to do that if they were replaced. Obviously, they don't want something taken away, but they'd be very willing to exchange for something that would be healthy. For
If
instance,
it was free, if it was provided free.
well, you're going to take a whole bunch of money and reduce the amount of soda consumed. 40% of SNAP purchases are for soda. That's going to free up a whole lot of money that can then be used to supplement,
But
to
it
improve
provides a
nutrition.
supplemental payment.
Well, you have to
Provide
understand.
that nutritious program.
You have to
In
understand.
other words, it's an additional support.
You have to understand that we are not really talking about nutrition, Ranking Member Bishop. We are talking about toxicology. You are providing a poison, and you are providing it at a free price point, and that is what needs to change.
Thank you very much. The gentleman from Washington, Mr. Newhouse.
Thank you, Mr. Chairman. Mr. Ranking Member, I appreciate everybody being here this morning to talk about a very important issue and the federal government's role in this issue. I would like to believe that most Americans have a good sense of what foods we ought to be eating more of and which ones we should be eating less of. We all have to make those decisions every day. Sometimes we get it, more often than not, we get it right. Sometimes you get it wrong. But I also believe that it's important to educate consumers to allow those shoppers to choose the right foods for their families. So nutrition counseling, personal accountability are important. The testimonies I've heard this morning mainly discuss restricting SNAP recipients from purchasing certain sugary products with the aim of improving health outcomes. And there is some mention of incentivizing recipients to make healthier choices, but I believe only one, Mr. Seligson, makes note of education to support consumption of healthier foods. According to USDA administrative data, as of October of last year, over 41 million people receive SNAP benefits. Average monthly benefits are about $190. So let me ask each of you, do you believe restricting SNAP recipients' purchases is the most effective method of changing an individual's habits and promoting better health outcomes? Could educating and incentivizing recipients to make better choices have a similar outcome, and why or why not? And start with you, Dr. Rashida.
Yes, thank you for the question. This question was answered in a pilot project already through a randomized control trial. It tested 3 different conditions. The most effective was restrictions paired with incentives. It was more effective than restrictions only, and both restrictions only and the restrictions paired with incentives was more effective than nothing at all.
Mr. Gay.
Currently, the GusNet program, which exists in the real world, and I know an Alabama grocer that has it, people who participate in GusNip in his store buy more fruits and vegetables than any of his average American customers would. So I think the program incentivizing and giving the people that if they buy healthier foods, we will incentivize that is probably the best way to go.
Thank you. Mr. Seligson.
Thank you, Congressman. Our research has showed that good food produces healthier outcomes, and so obviously we would support programs and incentives that would encourage that. Obviously, I'm here speaking strictly from the research that our foundation's conducted and through drivers of health and the impact it has on people's health. So I would say good education and incentives for our program.
Nomination. Dr. Lustig.
Education has not solved any substance abuse any time in the history of mankind. Did Nancy Reagan's just say no work? We have an opioid crisis. In fact, the Iron Law of Public Health, which was basically developed around alcohol starting in 1613, shows that reduction in a substance reduces consumption, which reduces health harms. It's the only thing that works. And it's the only thing that has worked, and it's the only thing that will work. We have the data.
Thank you. Thank you all. One of the things that I'm concerned with is that implementing a pilot to restrict SNAP purchases could pose some logistical difficulties. Not getting into the weeds of individual SKUs or stock keeping units at grocery stores and whether they would be eligible or not is probably where things would get challenging for our retailers. How do we avoid a list of good foods versus bad foods, which could be subjective, and instead encourage that pattern of healthy eating? We'll start up with you, Dr. Lustig.
So I'm not for good foods or bad foods. I'm for all good foods, and all foods are inherently good. It's what we do to the food that's not. That's called ultra-processed food. And ultra-processed food is two things: added sugar and removal of fiber. The sugar is toxic, the sugar is addictive, and the fiber is what mitigates that, the absorption, so that ultimately it reduces the burden on the body.
Thank you.
It is the transition from our ancestral diet to our current ultra-processed food diet that has driven all of this. So the question is, how do you make ultra-processed food healthy? That's ultimately the question. And is it possible? And the answer is yes, it is possible. I'm actually working with a company offshore in Kuwait called Kuwaiti Danish Dairy to do exactly that by adhering to four principles. Number one,
I'm running
get
out
rid
of
the
time.
sugar.
I'd like the others to be able to answer.
Sorry?
I'm running out of time
Yeah,
here, so I'd
understand.
like the others to be able to answer. So
Get
thank
rid of the
you. Thank
sugar,
you.
add the fiber, add omega-3s, get rid of the emulsifiers.
Appreciate that. If Mr. Chairman, if the rest could answer. Thank you, Mr. Seligson.
I would again say that our research shows that good fresh food and unprocessed food provides a healthier outcome for patients.
Yep, good.
Just for the implementation part, without that list, like we have for WIC of good versus bad foods, implementation at the register as far as the SKUs go would be extremely difficult and could really back up lines at a cash register.
And I'll just add, I was the one who wrote New York City's proposal to the USDA to do pilot restrictions in 2011. And we approached it by starting with foods that are clearly not nutritious, such as sugary beverages that have a clear definition, giving that list, and then grocers can add that to their list of list of items that they already restrict, but really starting with very clear products that have no nutritional value.
I appreciate that. Thank you for your indulgence, Mr. Chairman. I yield back.
Thank you very much. The gentlelady from Ohio is recognized.
Thank you, Mr. Chairman, and I'm really glad I came this morning to the hearing. I want to thank each of you. Mr. Chairman, I want to thank you for opening this dialogue about any type of incentive program and how it might be structured to be actually effective. And I want to thank Ranking Member Bishop for bringing up some of the challenges we have in creating any kind of program. I'm from the state of Ohio, and I read a book called The Last Child in the Woods, which really had an impact on me. And it talked about, I think the author is Robert Lavelle, but he was talking about how youth today, and really the whole American population for the most part, is divorced from the earth and the earth's productivity. And that's exactly the reverse of when we were first founded as a nation. Obviously, we're not the frontier anymore. But I think that that lack of connectivity to nature is a real problem for our country, and for any advanced country, really. But this food issue fits into that. And I wanted to just bring up this issue of what we learn, how we function, what we experience as young people. I was very fortunate. I grew up in a truck garden area. So we ran a family market. We knew where food came from. Dad made so many things himself, and our mother was blessed by that great upbringing. Most children do not experience that in our country, and most of the schools I represent do not teach cooking. They don't, the culinary arts, in fact, all the restaurants, most of 90% of them in my area say, Congresswoman, we need workforce development. Nobody knows how to cook. It's very interesting what's happening. And so this issue of processed food is a real issue. And how do you move back to a more wholesome lifestyle and more wholesome food? I wish I had a full answer on that, and I'm glad I'm here this morning. We have hospitals back in my area, doctors prescribing food as medicine now because of some of the issues we've been talking about here. So pieces of the American public are waking up and saying, wait a minute, something's not going right. But it's so disparate. It's not together. It's not one of the greatest farmers I represent went to Mayo Clinic and brought back to Ohio a pharmacologist trying to understand why people had so many gut-related illnesses and so forth. And he said, Marcy, I spell it Pharmacoloigist, pharmacologist, because he's trying to figure out, and he told me, he said, when my father farmed this same land, if I pull up a carrot, and he's an organic farmer, today there are 50% less nutrients in the carrot than 1950. Why is that? What's happened to the soil? What's happened to the environment? So we have people back in our area focused on this. Our children, this is an enemy of health. I don't know what's going to happen 20 years from now, but the average time in front of a blue screen today is about 7 hours. That is a complete turnaround from the way I grew up. And kids spend less time in the environment doing anything constructive. And most of what we all eat is processed. And that is very, very harmful. So I would just say to the chairman, what I'm interested in, if I were a fairy godmother, I would put a garden in every school, and I would make it part of the curriculum. And I would work with our local leaders, our farmers, and the whole USDA is set up so that the benefit goes to sort of the countryside for production knowledge of how to be more efficient, but the dollars go to the SNAP programs and the food programs, and there's a total disconnect. It's just a very interesting department, very frustrating actually, to try to work with. They're good people, but our lifestyle has changed so much. So, Mr. Chairman, I think a couple experiments in some very specific places, working with members on both sides of the aisle. I admire Congressman Newhouse because he actually raises small fruits and with high antioxidant benefits. He actually knows something about this. And somehow we're missing the mark as a country. And in our schools, the diets are all processed. I invite anybody to come to my district and any district here and just spend a day in the school programs. That's a whole nother speech, but it isn't working. So I agree with the panelists. Everybody's trying hard, but I do think I agree with the chairman in terms of a model. I wouldn't take the money from SNAP. I'd figure out some other funding sources, but you're on to something, and I think we can make it bipartisan. So thank you. I don't have a question of you. I just wanted to express that for the record. And you're on the right track. Keep at it and help us do better for our country and for not just our youth, but for all people. Thank you.
Thank you very much. The gentleman from Virginia.
Thank you, Mr. Chairman. This is a timely hearing, and it's on a subject that I think there's a lot of room for bipartisan work. I share a lot of the views of the gentlelady from Ohio. In the 6th District of Virginia, it's a very rural district, and we do have very active FFA programs. We have ag in the classroom. There is a very strong connection between the farmers that make up one of the largest economic drivers in our district and the classroom where the kids are learning. So I think we just need to encourage that connection in more places. I also think that encouraging encouraging healthy eating, healthy habits is important. So we need to find ways to do that. Incentives are one way, but also we need to look at ways to ensure that taxpayer dollars are used wisely. So I would ask Dr. Lustig, in addition to restrictions, currently when we're dealing with food stamps, we have work requirements. What is the impact of work on the ability of a healthy adult to accommodate foods of varying health levels?
Well, we have a problem of absenteeism, and we also have a problem of presenteeism. We have people who are in their jobs and are not able to do their jobs because, number one, they're in the bathroom every hour because of their type 2 diabetes, or because they have brain fog because of their mild cognitive impairment. And so they are basically soaking up a salary and not able to do their job. So the problem is multifold, and I'm not saying it's
Work requirements
only.
are better than no work requirements, right?
Yes, absolutely. But the fact of the matter is that employers today have to pay $2,750 for health insurance per employee per year for metabolic syndrome-related diseases, whether that employee is sick or not. And that is basically breaking the bank, and it's also reducing their ability to hire more individuals.
Dr. Rashidi, current law requires that able-bodied adults without dependents must work, train, or volunteer at least part-time to remain eligible for food stamps. But many states waive those work requirements for as many able-bodied adults as possible. Do you think that able-bodied adults without dependents who are mentally and physically fit for employment should be required to comply with federal work requirements? And why do you think states are abusing these loopholes to eliminate work requirements for millions of able-bodied working adults across the country?
I do think that able-bodied adults, there should be an expectation for work among those who are receiving SNAP. One of the main reasons is that we know from decades of research that employment is the most likely path people can take to get themselves out of poverty. And to the extent that SNAP disincentivizes employment because of the way the benefit structure is set up, we should be requiring employment among those who are able-bodied, yes.
And it gets them off the couch.
Yes, there's so many non-financial benefits to work that is also crucial, social connections. I will add to that, yes, states do abuse the ability to waive this policy. The waivers were put in place so that when unemployment is very high and jobs aren't available, then people shouldn't be expected to work, but that's not how it's being applied right now. And
They did it in COVID, but too many are still putting those in place. We've also got a situation where more than 5.4 million recipients of food stamps do not meet federal eligibility criteria, income level criteria. They've been enrolled through a broad-based categorical eligibility loophole and have incomes and assets above the federal limits. What is the purpose of federal eligibility standards and asset tests? And if we close this BBCE loophole, which I have a bill that would do just that, who would lose benefits given that eligibility is already established under federal guidelines?
If you were to close the loophole, people that have very high assets would lose benefits, and that's not the target population of the program. And also those who are above the income eligibility criteria, which is 130% of poverty, they would also lose eligibility.
Thank you. I yield back.
Thank you very much, gentlelady from Illinois.
Thank you, Mr. Chairman, and thank you to our witnesses for being here today. Since taking the majority this Congress, we've seen this majority put forth policy after policy that cuts federal assistance for Americans in need. Just last year, MAGA extremists held our economy hostage to pass new restrictions for those seeking federal assistance, including SNAP. These new requirements, pushed by the majority, put nearly 750,000 Americans at risk of losing their nutrition assistance and added more hurdles for those already facing economic hardship. Now they're going further. Tomorrow, they're holding a markup of a proposed farm bill that would hurt farmers' bottom line and cut nutrition assistance even more. And in this committee, the majority is trying to restrict what SNAP recipients can buy with their benefits in a way that hurts recipients, hurts grocers and producers, and simply does not align with the data. As a nurse, I know that when we talk about evidence-based policies, it's evident that SNAP works. SNAP participants have better health outcomes than non-participants at similar income levels. One study found that low-income adults participating in SNAP incur about $1,400 or nearly 25% lower medical care costs per year than low-income non-participants. Instead of raising healthcare and grocery bills for hungry families, we ought to strengthen SNAP and prioritize incentive-based programs that are proven to work. These programs include the Healthy Food Financing Initiative, which includes grants, loans, and technical assistance services to projects that will improve access to fresh, healthy foods in underserved rural and urban areas. In addition, the Gus Schumacher Nutrition Incentive Program provides funding incentives to income-eligible consumers to increase the purchase of fruits and vegetables and prescriptions for fresh fruits and vegetables. Mr. Gay, as a grocery store owner, how have incentive programs like the Healthy Food Financing Initiative and the Gus Schumacher Nutrition Incentive Program affected your ability to provide fresh, healthy foods to your customers, especially in underserved areas?
Personally, the only experience I have with Gut SNP is through other grocers that I know through NGA. And like I said, one of the original pilot for that was Jimmy Wright in Alabama. And his Gut SNP participation was so great that the customers on Gut SNP actually were purchasing more fruits and vegetables than his average customers were. So that's the only personal link I have to that currently. We are looking into getting into that program just from what Jimmy has recommended to me. But I think it would be great for my customers to be able to double up their money in the produce department.
So just to repeat back what I heard you say is that your colleague reports that his customers participating in the program are buying more fresh fruits and vegetables than non-participants.
That's correct, yes, ma'am.
Okay. These programs are crucial to supporting communities as they pursue healthy options. There's compelling evidence that they are effective at improving nutrition and food security, which in turn lowers healthcare costs. For example, participants receiving nutrition incentives and produce prescriptions through Gus SNP projects reported higher fruit and vegetable intake than the average U.S. adult, consistent with your testimony. Instead of grappling with the reality of what our communities are facing and the evolving problem of food insecurity, the proposal that we're debating today is completely divorced from the needs of families and small businesses we represent. Mr. Gay, considering the logistical challenges that small and independent store owners would face in implementing this so-called SNAP Choice program, how would you expect this to influence a store's decision to participate as an authorized SNAP retailer?
Truthfully, in the beginning, you would give it a shot to see how you stay on. I mean, in a community like mine, I'm the only grocery store there. And based on just some of the things I've heard today, I'm not sure that any of the dollar stores would be eligible to sell food if we went to these restrictions. So you really would limit the access that people would have to food. So regardless of my business interest at that point, I would probably, obviously entertain the program to make sure that people had access to food. But it's an unknown right now. When we talk about WIC, which is obviously the comparable to this, it's, roughly a handful of items compared to what could be approved on this. So the implementation of it, is just real cloudy right now because it's just such a vast, more items that would have to be approved or disapproved.
Yeah.
And then if it wasn't at a federal level, which WIC is a federal basket, and states were able to decide, you just throw that much more mix into it. Again, with the border towns, that different states, they could go easily to a different state and purchase different things with their cards.
Well, thank you for your commitment to meeting the dietary needs of your community despite whatever business conditions these types of programs might affect. Improving public health requires investing in proven programs that support healthy families, not attacking those programs for political reasons. As a committee, let's prioritize solutions that have real and lasting impact on the health and well-being of all Americans rather than pursuing restrictive and punitive measures that fail to address the root causes of health disparities and food insecurity. Thank you. I yield back.
Thank you very much. The gentlelady from Iowa.
Thank you, Mr. Chairman, and Ranking Member for holding this hearing. To our panel of witnesses, thank you so much for your expertise, and it's very clear you're all very invested in the outcomes of these programs, federal nutrition assistance programs like SNAP. So, Dr. Rashidi, I want to start with a question for you. In your written testimony, you detailed that since its expansion in the 60s and 70s, SNAP and other federal nutrition programs have made a lot of great progress in reducing food insecurity, which is the goal for low-income Americans and children. But you also note that SNAP is performing poorly in supporting nutrition outcomes, with SNAP recipients being more likely than low-income non-recipients to experience diet-related disease or obesity. So what is the true cause here for this disparity in health outcomes between SNAP participants and the low-income Americans who are not in the program?
It's an excellent question, because low-income people are drawn to SNAP because they need help in terms of resources. And generally, they're low-income because they don't have employment, and health issues contribute to that. So in other words, SNAP is kind of drawing already a somewhat unhealthier population because they're facing those barriers to employment. So to the question of cause, it's unclear if SNAP is causing poor health or if it's just kind of allowing SNAP participants to maintain the poor health that put them in that position in the first place.
I was going to say, are the poor outcomes new with SNAP, or is it kind of something that's always been a challenge associated with the program?
Right.
Maybe for the reasons you just kind of talked about, this vicious circle, perhaps.
Right, more always a challenge, but I think the point is SNAP's not doing much to improve the problem.
Yeah. So are there specific areas of SNAP that you think could lead to these poor outcomes, and what would you recommend that we as policymakers do to help in that cycle?
Specific things to improve the outcomes? Yes, definitely. I mean, I'm in favor of incentives. I think there's some positive things about incentive programs. The problems with incentive programs is it does lead to more fruit and vegetable purchases, but it has not shown to lead to less consumption of unhealthy items. So I think that's why the idea to pair incentives with restrictions is a better option.
So outreach and education for participants is really critical here, informing Americans about ways that they can perhaps improve their diets and nutrition, as well as making their food dollars go further. So I think then that is a good transition into programs like SNAP-Ed, expanded food and nutrition education program, which are intended to help connect low-income Americans with SNAP participants with information to help support their healthy lifestyles. So to our physician and Mr. Seligson, what are your thoughts on the effectiveness of those educational programs to help support healthy eating?
So I'd like to pick up on where Dr. Rashidi just left off and your question. Toxin A plus antidote B still equals death. If you don't target the problem, you don't solve the problem. And that's what we've done with SNAP. So people talk about fortification, vitamin C, for instance, in fruit juice. That's not taking care of the toxin, which is the added sugar. You could say, well, there's no added sugar in juice. Yes, there is, because as soon as you take away the fiber, you have flooded your liver and you have flooded your brain with this mitochondrial toxin. So I am completely for incentive programs. I am completely for increasing fruit and vegetable intake. But until we get the sugar out of the American diet, and SNAP being one of the places where the sugar is most prevalent in the American diet, this is not going to solve the problem because you haven't dealt with the problem.
Mr. Seligson?
I just go back to the same thing about identifying you through education and through incentives to encourage people to eat a healthier lifestyle, provide resources so they can have better resources to eat and be healthier has got to be built into any pilot program that you consider. Obviously, you know, the bottom line is we all want people, our most vulnerable citizens, to get the good nutrition they need to live good, healthy lives.
Do you think that there's more that can be done in terms of getting this information out, whether it's through USDA or through our grocers, you know, and so the people actually have this information in front of them? Is it something that we should have at point of sale where maybe, you know, a cashier doesn't necessarily have to say, oh, this has more sugar in it than you should be buying, but hey, is there some sort of disclaimer that needs to be there? I mean, we have disclaimers all over for tobacco and alcohol. So is there more that can be done there?
I think the more education you have available to citizens, the better off we're all going to be. You know, the more information that's available in all aspects of our lives will help make us more knowledgeable what's better for us.
Thank you. Yeah, go ahead.
Last year, I was on the Hill and had an audience with Secretary Vilsack and Secretary Becerra. on exactly this, that Representative Gephardt brokered for us. And they are both very interested in increasing public service campaigns around added sugar because they do understand the problem. But both of them said that Congress is the problem.
Okay, thank you.
Thank you very much. Calling the ranking member, Ms. DeLauro.
Thank you so much, Mr. Chairman. I'm sorry to be bouncing around at hearings, but just on this last point, and I've got a bunch of questions. I don't know that Congress is the problem because I introduced a number of years ago a tax on sugary beverages. Let me just tell you, the industry came out of the woodwork. Out of the woodwork. It's not the Congress, but the industry. So let's place, you know, the concern where it needs to be. Believe me.
I met with your staff.
And I still have the legislation, because I believe the issue of sugar is absolutely right, and we should do it. Mr. Seligson, in your testimony, you mentioned that 80% of health outcomes are dependent on socioeconomic factors such as healthy food, safe housing. I appreciate your bringing this up. I really have been a fierce, I think my colleagues can attest, a fierce advocate in Congress for increasing access to healthy and nutritious foods through the federal food and nutrition programs. For food safety, to ensure that the food we eat is not only nutritious, but also safe. Let me just ask you, I'm going to ask you to be quick in answers because I don't want to go over my time with the chair here. Would you agree to fully address the epidemic of diet-related chronic disease plaguing the nation? That's your quote. The federal government should be forced to focus on efforts to increase access to healthy and nutritious foods.
Yes.
Okay. Let me just also mention that if you take a look at what happened in the last budget year here, there was the majority cut the fruit and vegetable voucher program attached to WIC. And it was a minority, and it was really the Democrats who, just did not allow that to happen. In addition to which they undercut the WIC program, and we made it a very strong point to say that we were not going to accept anything but the $1 billion increase, because it was addressing a shortfall for the WIC program. So yes, federal government should be focused on efforts to increase access to healthy and nutritious foods. I find the pilot incredibly disingenuous because aside from the fact that the majority sought to drastically cut the fruit and vegetable benefit, slash the program by funding $800 million. We are now discussing the restriction of SNAP purchases. If the majority was serious about health outcomes, we would fully support the WIC program. And as the program is truly notorious for improving birth outcomes and decreases healthcare costs. Back to SNAP choice. Mr. Seligson, how do you believe food costs play a role in SNAP participants accessing healthy and nutritious foods?
I think it plays a role in everybody's
Right.
economic status.
So it's cost.
Cost of food is expensive, and cost, healthier food is probably a little bit more expensive, but I feel, in answer to your question, gets back to the same issue of social drivers. Providing the good opportunities and access to good quality foods will improve physicians' outcome.
Sure.
Advocating for physicians my entire life, or most of my entire career, I can tell you that they're under a lot of stress because of the realities of some of these things we're talking about when patients present themselves with different diagnoses that they can try to treat, but when the patient's not getting the right kind
Sure.
of foods they need, or access to the doctor's office, or transportation, whatever the case may be, it really inhibits the doctor's ability to get that patient better, healthier,
properly
quicker.
and makes it
And so
perfect.
that's
So-
where I come from,
Right.
is that anything that we can do
Right.
to make a program
I
better.
appreciate that. I've got your message. You're there. You understand that we need to deal with that. Just yesterday, let me just tell you, Target announced it will lower prices on roughly 5,000 items, including food items such as bread, fruit, vegetables, milk, and meat. I applaud the decision. I find it fascinating that the company could just so easily lower prices for hardworking Americans, while over the last 4 years, Americans have faced a 25% increase in their grocery bills. That is not just the fault of inflation, Researchers found that corporate profits accounted for more than 50% of food price increases between 2020 and 2021. This decision comes following a letter I sent along with my colleagues urging President Biden to use executive action to address the price gouging and the price fixing of mega groceries and large corporations. If that isn't enough for us, a March report from the Federal Trade Commission claimed that grocery stores took advantage of supply chain disruptions to raise prices and keep them high. So let me ask you this. Don't you believe that the federal government's time would be best spent on combating illegal practices that raise prices on healthy and nutritious foods for over 340 million Americans living in this country, as opposed to a pilot that will look to at SNAP purchases for a tiny fraction of the 42 million participants that this program services?
I don't know if I can really adequately address that question other than say it goes back to the research of providing good, healthy foods to people.
But do you, about food prices?
Yeah, I just, I really can't speak to how you control food prices. I don't know enough
There is
about
no
that.
shortage of food in the United States of America. That means the industry has the ability to raise or lower prices at will. And if, at the moment, their will is to, truly it is price gouging. That what they do, that if you can lower the price one day, and then you raise the price another day, that is within your control. It would just seem to me that one of the purposes that the federal government can play here is to go after those who are price gouging, deal with legislation that doesn't allow them to do that. But we spend our time, and look, the SNAP program is always an issue of controversy in this institution for some reason. But let's go to a fundamental thing. If we want people to buy fresh fruit and vegetables, et cetera, make it available for them, make it available at the cost that they can afford. Not just the affluent, but the middle class, working families, and families that are vulnerable. I yield back.
Thank you very much. The gentleman from Alabama is recognized.
Thank you, Mr. Chairman. I apologize for my tardiness, but as you well know, there are several different meetings going on right now, so we're sprinting back and forth. The Supplemental Nutritional Assistance Program, SNAP as we all know it, has been a vital resource for millions of Americans, providing essential assistance to families in need. However, the type of foods eligible for purchase under SNAP have been raised concerns among small business owners, particularly those in rural areas, which obviously in my district, I have a lot of rural area grocery stores. Those proposed changes could significantly impact the way store managers inventory and operate. Rural grocers face a unique challenge due to the small size, limited resources, and often tight margins compared to the large urban supermarkets. Given the critical role that the rural grocers play in their community, ensuring access to healthy foods while maintaining their business viability is essential. It's important to understand the obstacles that these small business owners might face. Mr. Gay, got a question for you. You weren't expecting me to call you, were you? Wake up. Mr. Gay, as a grocery operator in a rural area, I understand, what challenges do you see for your store in navigating through these potential SNAP restrictions?
If some of these restrictions were to come online, like I said before, I'm really the only access to fresh fruits and vegetables in the community. So if these loose terms that have been used for the food so far are continued to go through, I just wonder about just the pure access that people would have to any food in the neighborhood that I'm in. And also, too, when you redirect that kind of money, $122 billion, as the chairman told us earlier, could we see stuff like we saw in the pandemic, like with shortages of baby formula, WIC bread, for example? When we take those dollars and redistribute it into a very limited amount of foods, what is that going to do to supply chain when that happens? So, just those things are troublesome to me as I prepared for this. But just as, just the access to food in a rural area, and then what happens to the supply chain.
So how might that increased bureaucracy requirements affect the ability to serve the community?
In the beginning, I mean, depending on how the rules shape up, I mean, if I wasn't ready day one, so to speak, to take food stamps when people were in the door, would they have access to it, and would they lose access for all the other smaller dollar type stores that are in my neighborhood? Would they even have the ability to use them at those stores anymore? And so the technology piece, while it sounds like it should be easy, and it's, we have restrictions on other things, but alcohol and tobacco are restricted by age, not by any department. So that's a whole different category. WIC is a very, very small category. It has a small flag on it. That the department that food stamps is right now is all of the grocery department. So just changing that is not going to be a simple, sit down in front of the computer for a couple hours. It could literally take weeks or up to a month. I don't have an IT staff. I'm the IT staff. So working with my warehouse and, my technology providers to try to set that up, it's not going to happen overnight.
So how would you set that up without an IT staff?
You would hope that if you happen to be in one of the states that was in the pilot, that your warehouse where you buy your groceries from would be able to help you in that. And then
The labeling process?
correct. And not even that. I mean, that's another thing too that we were interested in. WIC currently by law has to be labeled on the shelf as a WIC item. I'm not sure how we would do that with food stamps, if we'd have to come up with a whole new system to label food on the shelf so that food stamp customers understood that this was now food they could buy on stamps versus right now it's basically anything on the shelf that's grocery they could buy. And it really is troublesome for me because we just spent $220,000 to buy digital tags for our store. WIC was already in that. So I'm sure the technology exists to have it changed if we had to do that, but I can't say that it does exist, and nor do I know how long it would take for that to exist. So that's a large investment that we just made that, I would hate to see go to waste.
Thank you, sir. Thank you, Mr. Chairman. I yield my time.
Thank you very much. Gentlelady from Florida is recognized.
Thank you, Mr. Chairman. Good morning, everyone, and thank you to our witnesses for bringing their perspectives today. More than 22 million American families rely on nutritional assistance to meet their daily needs. I am sure most of you are aware of that. SNAP has been the bedrock of our federal nutritional assistance for decades. When families receive SNAP benefits, they have more resources to go and buy healthy groceries. A key reason for SNAP's success is that it relies on the private sector to implement through purchasing food at grocery stores and other retail outlets. With few restrictions, SNAP recipients can determine which items are most needed for their own families, subject to prevailing prices and their own tastes, preferences, and nutritional needs. Adding additional restrictions and bureaucratic layers to the program will only undermine its effectiveness and will be unlikely to change diets, which is the goal. There are simply better policy options for promoting healthy eating patterns, both for SNAP recipients and for all Americans. But let's talk about what it would take to actually implement a full-scale program like Republicans are suggesting. There are more than 650,000 food and beverage products on the market today, and 20,000 more are introduced annually. No clear standard currently exists for defining these foods as, quote, healthy or, quote, unhealthy, or as luxury items. Creating such standards would be difficult at best and would require USDA to categorize and track the nutritional profile of each good in order to produce a SNAP-eligible foods list. The list would have to be maintained continuously and communicated to retailers and consumers in real time. Mr. Gay, do you think this pilot program would be successful in achieving its goals without adding significant administrative costs?
Not currently as it stands. Like, again, just putting that stuff into a system, and again, with no federal guidance on, every state, as I've read it, seems that they would be able to pick and choose the foods they have. And again, comparable to WIC, that's a very limited amount of food. They give me those UPCs, and when the customer comes to the register, if it's not one of those UPCs, WIC does not pay for it.
Thank you. When SNAP increases low-income families' grocery purchasing power, families can buy more nutritious foods that they otherwise couldn't afford. And that's supported by a recent study that found a $30 increase in monthly SNAP benefits increases participants' consumption of nutritious foods like vegetables and healthy proteins while reducing food insecurity and consumption of fast food. Mr. Gay, can you talk about how SNAP has improved the health and diets of the participants that you're familiar with?
Yes. So just to that, I mean, including with another program, with the additional dollars that stayed into the WIC program, for example, produce sales have increased a fair amount in my store with WIC customers because they still do have those added dollars that were not taken out in the latest bill. And I know it seems counterproductive because, yes, I need these people to be healthy. We just took out a loan for this store, and I need it to be around for about 20 more years to make it worth taking the loan out for. So I don't want people to die young, and so I have a vested interest in their health. I've been working with the local culinary community to try to bring in what I do miss or the things that I've seen before this hearing are the days of older ladies coming in the morning, going to my reduced produce rack and my reduced meat rack, and being able to see what's on that rack and go, this is what I can make out of that, and taking that food home. That's still perfectly fine to eat. There's just a little blemish on a pepper, or the ground beef might just be where I don't want to sell it because it doesn't meet my standards anymore. And so we are missing that element of people being able to go home and cook for themselves. And I think that is going to be a bigger driver of health than trying to restrict these SNAP participants.
And how would you say the Republican proposal would impact inflation on food prices, given the administrative costs?
Again, the administrative costs would be, you would bear it and move on, but the biggest thing is redirecting all those dollars to a smaller amount of food. Much like we saw during COVID, WIC participants in my store, for example, couldn't buy any bread because the 16-ounce bread that they do make for WIC is one of the least selling things that the bread company makes. They actually only make it for WIC. So when that happened and they made 20-ounce bread, that UPC wasn't approved to be purchased. And so I just don't think that we've thought through all of the supply chain impacts that could come of this as we redirect those dollars to a much smaller swath of food.
Thank you. And lastly, I want to just focus on the summer EBT program, which was created as a pilot program and fully authorized by Congress in December of 2022 due to its overwhelming success. My home state of Florida was set to receive $248 million for this program, helping to feed around 2 million children across our state when school is out of session. But unfortunately, for political reasons, Governor Ron DeSantis inexplicably opted out of the program, leaving families across the state in shock at his decision. I urge the governor to reverse course next year when he is faced with the same decision. If he doesn't, our children will pay the price. Thank you, Mr. Chairman. I yield back.
Thank you very much. And now we'll have a second round of questions. Mr. Gay, you don't think the cost would go up like 25% if we did this stuff, 25% in your store? Because that's what the Biden food inflation number is. So who would pale in comparison if it went up 1 or 2%? It's a rhetorical question you don't have to answer. Look, let's get this back to science, okay? Because the science is pretty clear. Dr. Lustig, alcohol has calories. It's calories, right?
7 calories per gram.
So by our definition, it could qualify as nutrition, right? It's calories, right?
So there's no dietitian.
Just like sugar, it's calories.
There's no dietitian on the planet that believes that alcohol is nutrition. And the reason is because there's no biochemical
And
reaction in
how
the body
many
that requires it.
dietitians believe that sugar is nutrition?
A whole bunch, like all of them. And the reason is
That's the
because
problem.
the Academy of Nutrition and Dietetics says so, and 90% of the Academy of Nutrition and Dietetics budget is underwritten by Big Food.
Right, so that's what it comes to, and to bring it around to the ranking members, observation, come full circle, because you said education rarely works, and I think you said never works, and
Never
I
works.
think you may be
Alone.
absolutely right.
Never works alone.
If we look at what affected tobacco, it was tobacco taxes. It was the economic signal of increased cost.
It was actually the secondhand smoke that actually reduced the consumption, and it was the secondhand smoke that ultimately allowed the Mississippi Attorney General to sue Big Tobacco
Correct.
for
And
Medicaid costs related to lung
That's right,
cancer.
and bring the price up, and Americans respond to that. They respond to economic signals much more than PSAs, just saying. So, Dr. Rashidi, in New York, you weren't going to cut because let's dispense with another straw man. Lots of straw men around here that we are cutting benefits with this proposal. I want to see it in black and white where it was ever suggested that my proposal would cut a benefit. It wouldn't cut a benefit, it would redirect spending. In your proposal in New York, what you proposed, and again, you very narrowly focused on sugary beverages. Not a whole lot of skews on that and pretty easy to determine, right? What were you going to do with the save? I mean, were you just hoping people were going to buy other nutritious foods instead of non-nutritious sugary beverages?
Yes, that was the hope, but again, we were proposing a pilot program so that we could study it to see if our hypothesis that people would purchase healthier food and reduce sugary beverage purchases, we wanted to test to see if that would be the results.
But you could in fact envision where a state would say, the best of both worlds is you say, okay, we're going to restrict this, and we know based on estimates that it's about 10% of costs, 10% sugary beverage, the other 10% of the 20% are salty snacks, other sugary things. So you could say, well, okay, well, what we're going to do is we're going to give you a voucher for 10% for fruits and vegetables. So the total amount of spending is exactly the same, and you're going to substitute fruits and vegetables for sugary beverages. Now, that could be one of the proposals, couldn't it?
Yes.
Is there any doubt in any one of your minds here that that would result in healthier America, healthier people on the SNAP program? Any doubt, Dr. Lustig, that would result in a healthier outcome?
Without question, that would be a
Mr.
great
Seligson?
godsend.
Yeah, agreed, would be healthier.
Mr. Gay? About health, just talking about health.
Yes, I believe it probably would help outcomes.
Dr. Rashidi, you think it would, right?
Yes.
That's why people are frustrated with Washington, D.C. The science is so clear on this. Just to get it right, and by the way, Dr. Lustig, in your testimony, sugar is not essential at all. I remember back from medical school, you had essential amino acids, essential fatty acids, you had there were no essential sugars, right?
There is no requirement for dietary fructose anywhere. There's no biochemical reaction in the body that requires dietary fructose.
Then I remember it right from biochemistry. There is
You've got it
none.
right.
So, Mr. Sell, I don't know which mentioned that there is a possible connection, might have been you, Dr. Lustig, between depression, anxiety, and psychological issues. And
Ultra-processed food has been shown to be correlated with depression and anxiety and numerous other mental health conditions.
It's unbelievable. Here in Washington, we want to spend billions of dollars in other things, in counseling and things, when we're like, wait a minute, let's go back to the original cost. And I think the gentlelady from Ohio who held up this cell phone hit it on the head. There's a reason why that cell phone is so addictive, and it's because of dopaminergic release, isn't it? It's exactly the same mechanism as sugar and gambling and all the other things you mentioned. This is, again, all I can tell you is, people have a very low opinion of Congress, and what you experience today is why people have a very low opinion. There is clear consensus that sugar is probably not good for you. It probably leads to type 2 diabetes and type 2 diabetes, obesity, salty snacks, hypertension. All of these, Dr. Seligson, in your testimony, 75% of our spending is on chronic disease. We actually know how we can prevent it, and here we are discussing straw men with this. Anyway, that's my frustration. I'm going to yield to the ranking member.
Thank you, Mr. Chairman. Mr. Gay, you make a powerful case that with 1 to 2% net profit margin, the cost of tracking hundreds of thousands of products in a SNAP pilot could be prohibitive. And particularly in your case, in a rural community where you provide perhaps the only option for healthy foods in your county, as well as in thousands of other rural communities across America, this would make it cost prohibitive, would it not?
Yes, sir. In the beginning, you just don't understand yet what kind of costs you would have to bear to make this work. And so just the addition of those costs, at some point, would it get out of hand to the point where it just wasn't worth doing anymore?
Dr. Rashidi, You say that the subcommittee proposal last year was to fund pilot programs, but it did no such thing. It just gave $2 million to USDA. Based on what we've seen from other research, a pilot could be many times more expensive than the $2 million. You say that the fact that FNS is conducting research on issues related to a pilot means that it supports efforts to assess whether SNAP restrictions could improve participants' nutrition. But let me be clear, in no way does FNS support the proposal in last year's bill. You say that a study in Minnesota that restricted sugary beverages, candy, and sweet baked goods improved participants' diets. It did not. The study conclusion says, and I quote, "This study failed to find evidence in support of prohibiting the purchase of sugary foods with food program funds as a strategy to improve program participant nutrition, even when paired with a fruit and vegetable incentive." You disparage the healthy incentives pilot as having no impact on sugary beverage consumption. That was not the intent of the pilot. It was purely designed to see if giving a 30% increase in SNAP benefits for every dollar spent on specified fruits and vegetables made a difference. The conclusion was this HIP impact is both statistically significant and large enough to be nutritionally relevant. The impact was sufficiently large to narrow the gap between current consumption and the Healthy People 2020 objectives for total fruit and vegetable intake by approximately 18%. This study, conducted in 2011 to 2012, involving 7,500 randomly selected SNAP participants in a single Massachusetts county, cost $4.4 million, of which only 6% were the increased benefits to recipients. The balance was for computer programming, recruitment, and training for retailers, administrative costs, and evaluation of the project. Again, this should be instructive to the subcommittee. I've not seen any awareness on the other side of the aisle that such an effort today would be as expensive, if not more expensive, as the Massachusetts pilot done 12 years ago. I am just really perplexed by the results that we're trying to get here as healthy food consumption without providing adequate resources for that to happen. I'd like to ask Dr. Seligson, would you support a voluntary multi-state pilot program? Would you support it if it was not voluntary? Would you
Sir,
support
can I
it-
respond to the comments you made directed to me?
You may.
Just really quickly, there were two comments you made. FNS has included in their research agenda SNAP restriction pilots, showing that they do support studying this question. And to your second point about the randomized control trial, I have personally talked to Dr. Lisa Harnick, who
They
ran
didn't
that
support
study.
the one that was proposed in the 2020
They did not
budget.
support the one that was specifically in this bill, but they
Exactly.
do support SNAP restrictions,
That was the
pilots.
point that I was making.
Okay, thank you. And then I have personally talked to Dr. Lisa Harnick, who ran the pilot in the SNAP-like program, and that was not her finding, so I'm not sure where you drew that quote from.
Dr. Seligson, would you support a pilot that includes a supplemental funding for food so that poor people can afford the healthiest foods?
Congressman Bishop, I did stay at a Holiday Inn Express last night, but I'm not a doctor. But
Mr. Seligson, excuse me.
No, that's okay. I just didn't want to overstate my qualifications. I advocate for physicians, and I'm not one. I think that gets back to, I think you've made some good valid points. I think the pilot project should help address that, would encourage, access to a program to get people the nutrients they need. And that's what our research has shown. I'll go back to, the social drivers of health, addressing the issue of providing people, our vulnerable citizens, with the most quality, nutrient dense products possible is the way that this program needs to go. And I think the concerns you're addressing should be incorporated, or try to be incorporated into the pilot project. We want, you know.
My time has expired. I've asked the chairman's indulgence to ask Dr. Lustig and Dr. Rashidi whether or not you would support a pilot that includes supplemental for food so that poor people can afford the healthiest foods.
Clearly,
You would?
absolutely. But in association with getting rid of the toxin in their diet.
Dr. Rashidi, would you support a pilot that includes supplemental funding for food that poor people can afford so that they can afford the healthiest foods?
I would support a study pairing restrictions with incentives, yes.
Incentives meaning supplemental food allowances?
Yes, and actually in New York, that's what we did. We had extra, we called them healthy bucks. They were extra money on top of SNAP dollars to purchase fruits and vegetables.
I yield back, Mr. Chairman.
Thank you very much.
But before I yield, I'd like to ask unanimous consent to introduce into the record a letter from several Maryland independent retailers and a letter from the Alliance to End Hunger and a letter from the National Medical Association opposing the SNAP restrictions.
I'm going to ask to see those before I rule on that. The gentlelady from Ohio is recognized. In your absence, I did mention you and the cell phone, and mention that it has the dopaminergic drive from using that cell phone. And you know those companies designed it that way. They designed those apps to make them addictive. Anyway, the gentlelady is recognized.
Mr. Chairman,
Yes.
those letters have been submitted to the staff.
I have not seen them, so if you could,
The staff has them.
before we close the hearing, if they're brought to me, I will rule on the unanimous consent request. Gentlelady from Ohio.
All right, thank you very much, and Mr. Chairman, and for your innovative spirit here, and also to the ranking member. And I think we're on to something, and your time hasn't been wasted in being here this morning. The question is, how do we do it in a bipartisan way? And if I could reinvent the world, I would ask the Botanical Gardens of the United States, which is controlled by this Congress right across the street, to do an experimental program. And I'm not suggesting this is the only thing we could ask, but imagine if we were to challenge some of our school food programs for the most healthy pizza that our kids could produce. And whether it's 2 million or 5 million, reward that school that's able to grow the vegetables themselves in good dirt and teach the children how to raise produce. I don't know about what you put the pizza on. I mean, that's a whole issue there of, healthy, nutritious substrate. But think what could be on it. Onions, tomatoes, peppers, all kinds of things that are healthy, and they would learn. They would learn. Yes, Doctor. I don't know if I'm, yes, please.
If I may, we are doing this in California. This
Are
is
you?
going on right now.
Where's it going on?
Our nonprofit is called eatreal.org, okay, Eat Real, and we are basically changing the K-12 throughout the entire state of California, and we have 5 other states that we're working with, 514 school districts. And we are teaching the kids in 4th grade with another nonprofit called Rainbow Chefs Academy. So this is actually going on. This is a project that is ultimately scalable, and we are working with Nancy Skinner in California legislature to bring this to the superintendent of public instruction, and hopefully we'll get
Well, these
done
kinds of
for the state of
experiments
California.
are very, very important, and not enough of them are happening. And if I could take, under our EQIP program, and roll up into my district, in every school, one of these controlled environmental growing chambers, we could grow right in there. We could grow in a modern way with hydroponics and everything. We do that in my part of the country. So,
By the way, you might talk with Senator Stabenow. She is.
she's
one of our-
phenomenal.
She's one of the
America
people
doesn't
working.
know when she leaves what we are losing in this Congress of the United States. She is so good. We have an urban agriculture program, and I'm interested in the schools because for many of the young people that I represent, the only food they get is in the school. So poverty's real, and it's biting, and it's horrible. And so the schools become harbors and safe harbors. And I'm really interested and worked on urban agriculture legislation that is managed by the Natural Resource Conservation Service. They should be involved because USDA is oriented toward the countryside. Production is oriented toward the countryside. Most of the people live in urban areas. Hello, you have to reconnect to where the people are. And in furtherance of your concern about sugar, I was thirsty the other day. I was driving in my car. I thought, oh, I'm going to go pull in the gas station. And I thought, oh, here's grape soda. And I looked on the back of it. How do you get 146% sugar? It should be solid. I mean, I thought to myself, how is that even possible? So it's unhealthy. And the choices, I noticed one of the bottling companies shrunk the size of their bottle. I thought, well, that's good. But the point is, we're not promoting healthy living for our people. And in Ohio, we have it's over 1 million diabetics out of 11 million people. So I think the chairman and the ranking member are onto something here. Maybe we can find a way to put our thoughts together. And if you could provide for the record some of these contacts that you've mentioned, and all of you who are sitting there. I grew up in a grocery store. Yours sounds a lot bigger than ours was. But what you know about what people like to eat and what they're not eating now, I mean, these are really important. And the grandmother I had, I mean, she invented soups. We didn't buy just Campbell's soup or something like that. It was all homemade. It was delicious. And not a whole lot of that is done anymore. So we find that some of our food banks have to actually teach people what a cup is. What a cup. How do you make a good bread? They don't know. And we don't teach it in most places. The wealthier the district, perhaps, I don't know, but I can tell you in the average district in the country, the whole culinary arts and what used to call home economics, that's all gone. And it's harming our people. They need help. Thank you for letting me expound here. And Mr. Chairman, you got a partner here, but not to diminish SNAP in any way, but to try to find a way for healthier living. Thank you all.
Thank you very much. Thank the gentlelady for coming back. And Mr. Bishop, the reason why I hesitate is because I think you mistakenly said the American Medical Association. It's the National Medical Association.
The national.
I thought you said the American I thought you said the AMA, and I didn't know you said the NMA. That's why. No, that's fine. It's no problem. I was just wondering, because I didn't see anything from the AMA. So without objection, they're entered into the record. Mr. Bishop, if you'd like a closing statement.
Thank you very much, Mr. Chairman. I would like to associate myself with the remarks of the gentlelady from Ohio and the chairman with respect to the incentive projects and the urban agriculture. Just last Friday, we had the secretary and the head of the NRCS in our district highlighting an urban agriculture program with a grant of $145,000, which was called Turnaround Columbus, which is an urban garden where they have elementary school, middle school, and high school students in cooperation with the school district and volunteers that are maintaining a community garden producing fruits and vegetables, fresh fruits and vegetables, where they are explaining and training young people into where the food actually comes from and teaching them how to grow it, grow the healthy foods. So I was very excited by that, and I think that that's the kind of education that we need to create the incentives for better health outcomes. And I want to express although I'm opposed to the SNAP choice concept that is being proposed by the subcommittee chair, I do want to express my hope that we won't see it in the 2025 bill and that we can come up with some bipartisanship as we, unlike in the 2025 bill. I'm hoping that we can come together and work on our mutual goal of healthy food, healthy consumption, and make the SNAP program and all of our nutrition programs effective, accessible, affordable, and produce ultimately the health outcomes that everybody here today has sought to have. And I think that if we work together cooperatively with the ultimate goal in mind, I think that we can do it without penalizing the 262,000 retail establishments that sell these foods and participate in the SNAP program, and we can do it in a way that is reasonable, that is certainly effective to get the desirable health outcomes. So I look forward to working with the subcommittee and with members of Congress all across government to try to make sure that we can make these programs work for the people for whom they're benefits, so that all of the American people can have healthy, nutritious food and healthy outcomes.
Thank you very much. In closing, although this is painted as a partisan issue, I will tell you, I worried about that. So a year ago, I live in deep blue Maryland, just in case anybody's wondering. I polled 1,000 Marylanders, the leading pollster in Maryland. 1,000 Marylanders asked a simple question. Do you think on the Supplemental Nutrition Assistance Program, we should restrict taxpayer dollars used for high sugar and snack foods, salty snack foods? 2 to 1, yes, we should do it. In every Democrats, Republicans, independents, older, younger, the only one where the only place it failed was in Baltimore City, where it was 49% said, no, you shouldn't restrict it, 48% said, yes, you should. 2 to 1. America knows that whatever we're doing isn't working. They look around in their families, in their healthcare systems. The doctors I know look in their offices. They know the diseases they see now versus the ones they saw 30 years ago and 40 years ago. We know, and again, look, I wish we could double the SNAP budget and all the extra on fruits and vegetables. But we have a $2 trillion deficit, $35 trillion debt. We have to live within the means. And again, in closing, I never recommended cutting $1 from SNAP. But I think it's a twofer. If you restrict sugar, and I think eventually some states might want to do salty snack foods too, because there's reason to believe that that would incur a huge savings, and instead spend that money, devise a way that money would be spent on truly nutritious foods, mostly fruits and vegetables. I guess that's the one that's the easiest to imagine. So I would hope that we could have bipartisan agreement on this. I hope we could work together to achieve a healthier outcome for Americans. Because again, and I appreciate all of you coming here to testify, but all of you know when you look around, those in the healthcare industry, those just living in the community, you look around and you know what we're doing is not working. It's not working. And this would be one step to send a clear signal, I think, again, economic signals are very important to Americans. And it's an economic signal when the government says, and again, with 2/3 of the population agreeing that this is not a good idea to spend money on unhealthy foods. Just like, again, we decide there are a whole bunch of things that we shouldn't spend money on. And this could be one of them. Anyway, I want to thank all of today's witnesses for taking time out of their busy schedules to join us to discuss the importance of providing nutritious foods in the SNAP program. We appreciate all of your input. I look forward to working with my colleagues truly on both sides of the aisle to get ahead of this problem, address the challenges as we move through our FY25 appropriations process. I thank you all for attending this hearing. The subcommittee stands adjourned. I got to send you the poll results.